Hi, everyone. Welcome to our first podcast for year 2025. In this podcast, we will discuss primary healthcare and health promotion in Pakistan. Dr. Hina Javed, Associate Professor at the Health Services Academy, is with us. Welcome, Dr. Hina.
Thank you very much. It's good to be back. And I think we are coming back after a long break this time. So,
Yes,
yeah.
we are. I think it's we- for a month and a half.
Yeah.
Let's start with our first question, Dr. Hina. What is primary healthcare and why is it important in Pakistan?
Okay. Thank you very much. This is a very important question. And it's important for the audience to know as well. Primary healthcare is healthcare which is being provided within the community, which means the individual or the patient or their families or the carer do not have to go to the hospital. So they approach a medical facility, a health center, which is within the community, and it is staffed by a qualified, trained primary care physician, and there are other services included in it, like advanced nurse practitioner, things like physiotherapist, occupational therapist, podiatrist, and then there are other cadres like lady health workers, uh, experienced nursing staff, vaccinators, nutritionists. Um, and in places where primary care is more advanced, there are specialist clinics, which are satellite clinics. Sometimes, for instance, the Department of Rheumatology conducts their on site in a remote area, a remote primary care facility once a week clinic, or there are general practitioners with special interest in things like dermatology, cardiology. Um, so they are able to pick up the diseases early and able
Mhm.
to refer them to the higher centers. So this is, in a nutshell, what a primary health care consists of.
Mhm.
Yeah.
And why is it important for Pakistan?
Okay. I think not only for Pakistan, it is important for every country
Yeah.
because it focuses on uh, in countries where there is a robust primary care system, people are healthier
Mhm.
because primary care physicians are meant to be educating the population. So somebody who's coming, for example, from a family, and he or she mentions they have got cardiovascular disease in a number of family members, first degree or second degree relatives, or cancers, then we filter out the high risk population and make them aware through education, through investigations, for example, blood test or other relevant test, screening tests for cancers, make them aware of what the danger signs are, what they need to look for if they are worried about the symptoms or if they develop the symptoms. So the primary care system is actually reducing the burden of disease in the society. So if you want to promote health and
Mhm.
keep the population in your
Mhm.
region, in your country healthier, then we must promote primary care. Yeah.
Thank you, Dr. Hina. So you said that primary healthcare is the first point of contact,
Mhm.
and then it reduces the burden on secondary and tertiary care facility, and that's why it's important for health promotion. So,
Yeah.
coming to health promotion, I was just wondering what is health promotion and why is it, and what are the key components of health promotion in primary healthcare?
Okay, so one of the key components for health promotion is health education. Uh,
Mhm.
and it's a two-way thing. We and that is why I use the word qualified and trained primary care physicians, because
Mhm.
remember, the ambit of primary care is huge, which is also called family medicine or general practice.
Mhm.
It covers things like non-communicable diseases, communicable diseases, and which also includes the non-communicable diseases, also includes things like cancer screening and mental health. And then we also look at the women health, men's health, adolescent, pediatric health, and elderly care. So you can see the vast areas that we cover. Um, Having a trained and a qualified primary care physician who has the insight into what they can offer to the society, particularly when it comes to non-pharmacological options for a number of conditions.
Mhm.
So it's a skill that they have to build. And once that skill is built, they'll be able to kind of transfer that knowledge to the population in simple terms without using medical jargon. So
Mhm.
they have to develop, the doctors have to develop, the doctors, the nurses, the advanced nurse practitioners. We deal
Mhm.
with a lot of multidisciplinary people. We deal with a lot of specialists. We interact with a lot of sectors within the country, not only in the health, but other. We are involved in patient advocacy as well. So you can see in a small way the role and responsibilities of a primary care physician. So coming back to the community education, once a doctor is more aware, the primary care physician, they are
Mhm.
able to develop the capacity of their patients. And I'll
Mhm.
give you a small example. For instance, a population just in the suburban area of Lahore, where
Mhm.
they established primary care center for a number of years, that population, compared to the other populations, is more aware of what to do when they develop diarrhea.
Mhm.
So a viral diarrhea, which is viral cause most of the times, they are aware that they have to consume ORS. Now
Mhm.
that's one tiny health education.
Mhm.
And they are also aware that they do not instantly need antibiotic unless they've got certain features, like a
Mhm.
high grade fever or blood coming in the stools and other alarming features.
Mhm.
So, but if you imagine the entire population, the urban and the peri-urban region of Lahore or any other major city is aware of it,
Mhm.
that will reduce the burden of disease and misuse of antibiotics or irrational prescribing. So once the population is more aware, it helps. It's a two-way thing.
Mhm.
Um, and as I mentioned, the other component is being part of the health policies.
Mhm.
So if the guidelines are being made, then primary care physicians must be taken on board.
Mhm.
Early detection of the disease, identifying the high risk population, and in terms of communicable diseases, Pakistan is carrying a huge burden of hepatitis B, C, and HIV.
Mhm.
So, and we are seeing a lot of cases of TB combined with HIV and vice versa.
Yeah.
So, uh, how to kind of the key areas, the hot spots, and that particular vulnerable marginalized population, how can they be looked after?
Mhm.
Um, and so, yeah, so defining health policies, disease prevention, we already have that much prevalence of the disease. How can we act to reduce the incidence or the development of new cases, and how we can prevent, what measures can be taken? Uh, so I think having a robust primary care will kind of reform the healthcare delivery system and the way the health services are working, reduce burden towards the secondary and tertiary care centers. So once the primary care start taking that justified load, which it is meant to take, but in order to take that load, they have to have a qualified human resource before they can do it. Yeah. So these are some of the components, basically.
Thank you, Dr. Hina. You've addressed my next question also, which was how can GP effectively promote health in their communities? So
Mhm.
you already touched upon this question in your response to my previous one. So I'll come to the next question, which is what are the major challenges in disease prevention in Pakistan primary healthcare system?
Okay. I think the first and the foremost challenge is um, not having a well-structured and organized primary care,
Mm,
um, particularly in the public sector domain. If you look at it, there is no post available. There is no post which is particularly dedicated to a primary care physician.
okay.
Um, so and that has affected us in a lot of ways. In terms of the postgraduate qualification, it
Mhm.
is not as the uptake by the freshly qualified graduates, and in selecting family medicine as a postgraduate career qualification, is not, the appetite isn't there. Recently, the subject of family medicine has been included in in the undergraduate curriculum. So in the future, we'll be able to see more people inclined towards a specialty. But I think we must utilize this time in order to kind of rearrange everything and promote postgraduate qualifications with training components, and kind of encourage more people to take it up. There are institutions across the country which are offering bridging programs, which are hybrid basically, and we are trying our best to kind of incorporate on-site sessions and encourage private sector to be part of it as well,
Mhm.
because the public sector on its own cannot build or reform the existing primary care, which is fragmented. So we are really grateful to our private sector organizations and healthcare facilities which are assisting us at the moment, in order to provide quality training to our postgraduate trainees. So I'm hopeful in the future. And I'm positive in the future there will be reforms and more awareness in the medical fraternity, at the provincial level, in terms of the political arena, and in the policymakers, stakeholders, and the bureaucracy, about. And I think multiple efforts are already taking place. We are the family medicine word is quite in social media, in print media. So we are making noises, and we are tapping in the right stakeholders to be able to be heard. So in future, I'm sure we'll be in a better position.
Thank you, Dr. Hina. Yeah, you're right. I mean, I remember when I became doctor about 30 years ago, we didn't have any knowledge of family medicine or general practice. And people who would just come out of medical schools after their internship, they'll be just thrown to the BHUs and RHCs, and they'll have to
Yeah,
struggle then without any training. And training or medicine equipment. So there was a lot of issues. And I think one of the main issue was also the poor situation of the health facilities, which discouraged a lot of young doctors from going to
that's
these
correct.
yeah these centers. But so rightly so, training is one of the most lack of trained health professionals is one of the most important gap
Yeah.
that we're facing. But
Mm.
how can GPs address these challenges to improve health prevention?
Okay. Um, I think individual GPs, they have to be parts of groups. And there are plenty of groups on social media, and they can pick and choose whichever is they fancy. There are organizations at international level, there are organizations at regional and national levels, and they have got their chapters as well. And there's a whole range of such organization. It's just a matter of an individual GP picking and choosing whichever he or she fancies and be part of it, and use it as a way to kind of enhance and go further up and identify. And those who want to, as I said, there are plenty of platforms for people to join, both online and on site, and they do regular conferences and sessions. Then once you enter into this arena, you identify, okay, what's happening around me in terms of clinical reforms, in terms of appearance of new guidelines, in terms of research. And you can show your interest, and which is the expression of interest, and be part of it. And as I said, we encourage. I'm like, for instance, I'm part of various platforms. For example, family medicine and women in the family practice. So we are encouraging a lot of female gender, and the other gender as well, to be part of the organization and the group. And then through the group, we interact with people from the South Asian region, from African region, American region, European, Australian, and all the other regions. So there is constant communication. It's like a global village. So and these things do affect us in terms of how we have been practicing, what changes, for instance, I need to make in the way I'm managing a certain condition clinically. There are organizations and health facilities who wish to support us, so we need to kind of identify, you can establish collaborations. Uh, and also, some projects do need the financial assistance. So if you can identify that economic or a donor support, then that is also, but it is something you have to kind of work on constantly. You may not succeed instantly, but if you are at the case, you will be able to get somewhere. So this is my message to all the independently practicing individual GPs would be to associate themselves with an institution, with an organization, and ensure you network quite extensively. Yeah.
Thank you, Dr. Hina. So, talking about global village and connecting with people, how do you think technology is impacting health promotion and disease prevention in primary health care?
I think technology has helped us in getting uh, it has a kind of made the networking much more easier. I understand there are time zones across the world, but people through the online sessions, through things like teleconsultation, has achieved a lot. And we are encouraging it basically. And I'll give you a small example. More recently, we were the faculty of HSA, in collaboration, the two departments collaborated and realized that we need to offer uh, a clinical audit course for primary care physicians. And we initially planned it to be on site, like a face to face session, but we were getting a number of requests from people outside Islamabad, Rawalpindi area to change it to an online.
Mm,
So we decided to change it so that a number of people, and the project all actually started for primary care physician, but we were asked to include other specialists, for example, dentists, allied health workers, nurses, pharmacists. So we
mhm,
have kind of reformed the entire thing and the way we are going to teach it. So it's a
mhm,
3-day online course, and I'm hoping a number of people will be able to benefit. And this is the education side of things. But when it comes to the clinical, for instance, telemedicine,
mhm,
uh, even if a doctor is based abroad in another country, they'll still be able to see their patients or be able to guide them.
mhm,
At the Health Services Academy, we are also planning to work on the home health services. So, um, the population which is not able to come to clinics, for instance, who are elderly, they have nobody to bring them to
mhm,
the doctor, or a young mother who hasn't got any transport and the husband's
mhm,
working away and she's kind of managing on her own. So
mhm.
at least they're able to be assessed through the telemedicine, either audio or a video consultation.
Okay.
Um, and they can be advised on what to do, whether to bring the child in to the doctor or take straight to the hospital based on the symptoms and the
Right.
signs. So I think, yeah, we can use, it is ideal to obviously see the patient face to face, but in places where it's not possible, it can be used as a triage system where we can give priority to who's urgent and who can be seen as a non-urgent. Yeah.
True, and I think in countries like Pakistan, where the basic health units are quite far away, and we
Yeah.
often don't have doctors posted there,
Yeah.
telemedicine could be a wonderful
Option.
area,
Yeah.
yeah, where people can get remote consultations. Yeah, thank you very much for this. Coming to the when we're talking about rural areas, we have in Pakistan a very large workforce, which are the community health workforce or lady health workers. What role do you think these lady health workers play in health promotion and disease prevention?
Okay, uh, I think that is one of the areas where Pakistan must feel proud of having one of the largest cadre of lady health workers, and they do an amazing job. They have assisted the healthcare system in providing vaccination, um, the pediatric population, and looking after women and the vulnerable population. And I think because they are actually going and having a direct interaction with the patient,
Mhm.
and because they visit houses, they can be the eyes and ears of the primary care system. And the information that they give back to us is important for us in deciding. And
Mm-hmm.
I think that group of professionals must be utilized to promote primary care physician, to promote primary care centers, and to encourage women and the other population to kind of approach and come out and see the doctor.
Mm-hmm.
It can be very helpful for us in promoting awareness about the contraception,
Mm-hmm.
uh, which helps us in the population control. And more recently, there have been talks in more than one provinces about using general practitioners or primary care physicians in promoting family planning services, which I think is a great initiative and it's commendable, because we are here to support such services within the community. And I think lady health workers can also be utilized in this area effectively. Yeah.
Yeah, I agree. When I was working in Lady Health Worker program, that was one of my impressions that they can identify patients and refer them to the hospital, to the basic health units where a GP would take care of them. And I think one of their role in maternal health outcomes by supporting the local midwives was also quite good, as well as, I mean, we all know what they do in polio campaign. So, I mean, that's one of that has become one of their main role in all these years. So,
Mm-hmm.
yeah, I think community health worker and GP combination is one
Mm-hmm.
of the success story in Pakistan. Um, okay, so what are the future directions for health promotion and disease prevention in Pakistan?
I think I, I'll be reiterating a lot of things which I've mentioned. Starting point would be having a very strong, resilient primary care system, because then you that becomes the center point, where yes, we will be as primary care physicians, we'll be taking a huge responsibility, but we will be needing the support and the will of the government and the private sector in making that a success story. uh, Primary care physicians interact with a number of individuals, not only just the patients, but um, all the services that are available. So, starting from pediatric to the other extreme of age, elderly population, and people who look after them. Um, certain, I think, certain decisions are very difficult for patients to make, and the doctors, the way they manage the condition by providing them options, by acting in the best interest of the patient, these things will help. So I think it is high time we must give primary care the spotlight that it needs and a chance to prove that it can share and reduce the burden of disease with the secondary and tertiary care. I think the momentum has been built up over the number of years, the past number of years, but I think that kind of avenue, that the opportunity, the window of opportunity must be given to them. Um, and I think the other thing that can make primary care more stronger is having a good leadership, um, which acts in the best interest of the primary care and focuses on the areas that needs to be focused on, that needs to be addressed, things that are making us weak. Um, and the networking doesn't have to be at a local level, it has to be international. And I think we'll get plenty of support if we ask for it, and there are plenty of people who are willing to support. So I think it's a good, time wise, we are in a good time zone, and I think there's a I'm hopeful the future is bright for primary care in future, provided it has certain essential ingredients in it. Um, there's a lot of potential for primary care to show what it can do. Yeah.
Thank you, Dr. Hina. Is there any other question that you think that we should be discussing before we move on to the takeaway messages?
My request to the GPs would be to stay up to date with the current guidelines for the common conditions. Um, be active part of a lot of activities that go on in relation to primary care, including be aware of the policies that are coming out, um, and do give your input. Be part of the active system, um, and make your voices heard. Um, the takeaway would be a to kind of always be accountable for what you do clinically, professionally, stay up to date in terms of knowledge and skills, and look out for all the ways through which you can promote your discipline, um, and leave a mark, and always try and train the junior doctors if you can, so you can pass on the abilities that you have, the attributes. Yeah.
So, what is your vision for future for the GPs when you think of talking about health promotion and prevention? What is your vision?
I think there's a lot of potential um, for, uh, uh, for our junior doctors. Firstly, we should sensitize the undergraduates, particularly those who are in the fourth and final year of the MBBS, the undergraduate qualification. Uh, Give them a chance to visit a primary care center. Show them what it is like to be a GP. What is the role and responsibility of a GP? Not very long ago, in December, I conducted a midterm OSCE exam, which was a practical exam. And that gave the students a taster of what general practice is about, what responsibility a GP carries.
Mm-hmm.
Because sometimes having the exam is the best form of learning, no matter how many online and on site face to face contact sessions you have given. But what you learn during the exam stays away with you. Um, and a number of the trainees were very kind of frightened of appearing in the exam. I said, if you fear, then you've lost the game already. You've nothing to lose. The worst thing is, what if I fail? So let's fail now rather than failing in the exit exam. So the feedback from the students was, now we realize. So the insight, what I'm trying to say is having the insight, and you can only get the insight once you have been exposed. And after the exam, a lot of trainees came to me and said, oh, I want to do the clinical rotation, something which I was emphasizing before and they were not keen. But it's the other way around now. They are asking for a clinical rotation. And Alhamdulillah, we have got some really good sites for primary care and hospital sites. And we recently had a great collaboration with one of the local hospitals as well. And we are looking forward to, so we are taking baby steps, and inshallah, I
Yeah,
do see future. Yeah.
it's really good to know what you're doing in that space, and best of luck for your future and
Thank
future of general practice in Pakistan. So I think we wind up our podcast for today, and then we'll have another one next week or the week following. But thank you very much for giving us time today for
you.
and updating us about health promotion and primary healthcare in Pakistan. Thank you very much, Dr. Hina.
Thank you.